This video is on cirrhosis. Cirrhosis is fibrosis of the liver such that there is architectural distortion to the extent that it leads to nodule formation. A patient may present with abdominal pain, pruritus, malaise, anorexia, and nausea. They may also be jaundiced, have peripheral edema, and muscle wasting. There are several causes of cirrhosis. The most common cause is alcoholic cirrhosis. Ethanol is converted to acetaldehyde by ADH, which combines with reactive oxygen species to cause hepatocyte damage. This also stimulates Kupffer cells and leads to fibrosis. Another common cause is viral hepatitis, normally from hepatitis B or C. We should also consider autoimmune causes of cirrhosis, such as biliary cirrhosis, and there are two main types. But these present with extra symptoms relating to cholesterol and copper deposition, such as hyperpigmentation and xanthosmata. Primary biliary cholangitis occurs when lymphocytes infiltrate into medium and small bile ducts, causing bile stasis and fibrosis and ultimately cirrhosis. In comparison, primary sclerosing cholangitis occurs when the entire biliary tree is involved. Finally, inherited disorders such as hemochromatosis, disrupted iron metabolism, and Wilson's disease with copper accumulation in the liver are possible. To diagnose cirrhosis, LFTs would show raised ALT, with AST being especially high from an alcoholic cause. FBCs may show anemia and grip and hold performed in case a transfusion is needed. Coagulation studies can also be reflective of hepatic function, as coagulation factors are synthesized in the liver. Liver biopsies and magnetic resonance cholangiopancreatography are useful in identifying autoimmune causes. It is very important to understand the several complications that can arise from cirrhosis. Portal hypertension arises from two main mechanisms. Firstly, fibrosis causes increased intrahepatic resistance and hence hypertension. Importantly, this can lead to blood being shunted away from the liver and be in places that are not designed to take this extra blood, such as the esophagus, umbilicus, and even rectum, leading to the signs of varices in these areas. Secondly, the reduced blood flow to the liver activates the renin-angiotensinogen and angiotensin system, where angiotensinogen is formed in the liver. This increases splenic blood flow, and along with sodium retention, causes fluid to leak into the peritoneal cavity. This is the main mechanism for ascites, and hence the patient would also present with a distended abdomen. This leads to the next complication, spontaneous bacterial peritonitis. This occurs when there's infection of the acidic fluid without an intra-abdominal source. This could be due to gut flora getting into mesenteric lymph nodes and seeding into acidic fluid. Common organisms include E. coli, Staph aureus, Streptococcus viridans, and Enterococcus. Another important cause is hepatic encephalopathy. This is alteration in mental status and cognitive function due to elevated ammonia levels, as it is not cleared by the liver. As portal hypertension causes vascular shunting, gut-derived neurotoxins can end up in the brain. While cirrhosis is the underlying cause, it can be precipitated by infection and electrolyte abnormalities such as hypokalemia. Hepatorenal syndrome may result as renal vasoconstriction causes renal failure. Finally, bone disease and malnutrition are possible complications. And finally, there can be coagulation defects. As the liver helps produce coagulation factors, portal hypertension can also cause thrombocytopenia and hypersplenism. If there's biliary cirrhosis, vitamin K cannot be excluded from the biliary tree. Thank you for watching. If you learned something, please tell a friend who may also find it useful.